Pleading with people.
तेजी से कोरोना की
A significant rise.
Triple digits
Foreign travel.
267 new cases of COVID-19.
The COVID-19 pandemic has swept through our towns, cities, and nations, leaving few untouched and many questioning the long-term impacts this virus will have on our global economy, way of life, and physical and mental health. With already 800,000 dead and 24 million cases worldwide, the staggering and life-changing COVID-19 crisis evokes the following question: what could we have done better? Well, here at Audax, we, a collection of 35 bold, multidisciplinary engineers, sought to answer exactly that question. Categorized into 3 distinct classes based on the strictness of their COVID-19 response, we evaluated 10 countries' responses in terms of their economic, social, ethical, political, and public health performance. As indicated in this figure, many countries with similar responses experienced greatly different outcomes over the course of the pandemic. For example, factors such as preparation, timing, and location played a key role in the differences in the outcomes that the UK and New Zealand experienced, despite utilizing a very similar strategy on paper. By analyzing the differences and similarities between several approaches, we were able to come up with the following optimal solution.
The goal of our recommendations is to ensure the health and safety of the population while minimizing social and economic disruption until a vaccine is created. Our recommendation consists of 5 key stages: prepare, inform, react, isolate, and manage. Each of these stages has a unique goal within the pandemic timeline to allow for optimal success.
The preparation stage begins as soon as the virus has been identified. The goal of the preparation phase is to ensure adequate health and safety resources are available. This will help to minimize the spread once the virus has appeared within a nation. In this phase, we recommend that each country works to gather personal protective equipment and establish a contact tracing network, allowing them to hit the ground running when the virus arrives. It is important to consider that such equipment may not be available or economically feasible for some nations or individuals, potentially limiting the value of the preparation phase. The purpose of the inform stage is to establish specific and clear lines of communication between the government, the public, relevant corporations, and international advisory agencies. We propose that a country initializes the information phase once a case has been confirmed. Establishing effective and transparent communication has been identified as a key behavior in successful countries. Hence, we recommend that once a case has been confirmed, the government should begin forming advisory boards and establishing clear communication lines to the general public. The purpose of the reaction phase is to slow community transmission with the goal of delaying or preventing isolative measures. We recommend beginning the reaction phase when a small cluster of cases have been identified within the country. In this phase, we recommend the country increases viral testing, encourages physical distancing, and heavily promotes the use of personal protective equipment.
Isolation serves to inhibit the rapid spread once the virus is well established within the country. The isolation phase aims to greatly reduce the rate of community transmission. In this phase, we recommend that businesses incorporate physical distancing and isolative measures, and governments encourage remote behavior and limited physical interactions. In this phase, it is important to consider how lockdowns affect gross domestic product and economic stability. Additionally, lockdowns can negatively impact the quality of life of the nation's citizens. We believe that it is crucial for each nation to find a personalized solution that will provide value to corporations, the government, and the general public. The management phase attempts to reduce human hardship and economical damage by easing the restrictions placed on the populace. The management phase can be thought of as a stricter version of the reaction phase. Transitions to this phase will begin when the number of active cases decreases to a controllable number. We recommend returning to the isolation phase should the number of cases reach an unmanageable level. Additionally, we recommend continuing the practices established in the preparation and inform phase, reinforcing the nation for the next wave of expected cases, as the timeline of the virus remains uncertain.
We at Audax believe that our proposed solution serves to maximize the well-being of the population while minimizing social and economic disruption.
It is important to remember that the proposed solution will be most effective when the requirements are tailored for each specific country. Thank you for your time.